Not your typical vacation. Still, more than 55,000 Americans traveled abroad last year as medical tourists. Medical correspondent Peggy Pico explains why more and more patients are outsourcing their own surgery. Peggy?
Well, Susan, surgery overseas is no longer just for the rich or famous as healthcare costs soar. In this country, everyday people like Ken Miller of Encinitas travel to exotic places for needed surgeries at discount prices. I need to warn you, there is a graphic video in this story.
I haven't been able to touch my toes for 5 years prior.
It was so bad. I'd tie his shoes. He couldn't bend down. I'd help him, get dressed. He couldn't even put his leg in his shorts.
Now, 4 months after hip surgery in India, Ken Miller is doing what doctors said he'd never do again.
2 of the doctors said I'm going to play golf for the rest of my life. That's it. You can't surf. You cut your last wave.
But you didn't?
No. Didn't do that route. I went to India.
To have hip resurfacing instead of hip replacement surgery, recommended by his U.S. doctor.
I really wasn't nervous. I had to do it. I knew I had to do it.
He traveled from his home in Encinitas to Chennai, India with Planet Hospital, a medical tourism company that sets up surgeries in more than a dozen foreign countries.
Everything from heart-related conditions such as valve replacements and artery bypass grafts, all the way to less serious surgeries.
Often saving patients money even if they have insurance.
So when I got home, my total bill was $10,500, and that was a 5-star hotel, the surgery, all my food, and all my entertainment for 18 days.
A savings of $50,000 for a typical hip replacement in the U.S.
On the way down to surgery, the lights in the elevator went out, and the elevator stopped. And, you're kind of thinking, hey, am I doing the right thing?
Sometimes the right thing isn't available here.
And also offering programs that are not available in this country as of yet, such as stem cell-based programs.
Video of Miller's surgery was done months before it was FDA approved in the U.S.
For the most part, people are choosing surgeons over a destination.
Still, top destinations are?
Well, I would say India, Thailand, and Singapore when it comes to Asia. And domestically, it's Mexico, Costa Rica, and Brazil.
Lots of research.
Advice from the Millers before you try the new wave of overseas surgery. Now, a few insurance companies are just now starting to cover some of the overseas surgery costs, and there are government agencies that monitor foreign medical care for Americans. You can get the price and the destination list of Planet Hospital surgeries by going to our website, NBCSanDiego.com, and click on Health Links. It's on our health page right under my picture. Marty?